Hello everyone, in this video I am going to discuss about the subclavian artery, the parts of the subclavian artery and the branches arising from the subclavian artery and the course of those branches briefly. So there are two subclavian arteries as right subclavian artery and left subclavian artery. As you can see here, the right subclavian artery is a branch of brachiocephalic trunk, while left subclavian artery arises from the aortic arch directly in the thorax. So, first we will look at into the course of the right subclavian artery. Right subclavian artery begins or origin from the brachiocephalic trunk behind the right sternoclavicular joint, and then this right subclavian artery arches upward and laterally over the pleura and between scalenus anterior muscle and scalenus medius muscles. At the outer border of the first rib, right subclavian artery becomes axillary artery. When we look at into the course of the left subclavian artery, it is directly origin from the aortic arch in the thorax and then ascends into the root of the neck, then arches laterally and has a course similarly in the right subclavian artery. It is also continues as the axillary artery after the outer border of the first rib. Each of these subclavian artery divides into three parts by the scalenus anterior muscle. The first part is the part from the origin up to the medial border of the scalenus anterior muscle. The part behind the scalenus anterior muscle is the second part of the subclavian artery. Then after the from the lateral border of the scalenus anterior muscle up to the outer border of the first rib is the third part of the subclavian artery. When we discuss about the branches arising from the each part, from the first part there are three branches. First, vertebral arteries, then the thyrocervical trunk, and then internal thoracic artery. Here also vertebral artery, thyrocervical trunk, and internal thoracic artery. From the second part, only one branch is arised. It is the costocervical trunk. Costocervical trunk arising from the second part of the subclavian artery. From the third part, only in some individuals we can see there is dorsal scapular artery which is arising from the third part. In some individuals, there is no branch arising from the third part of the subclavian artery. In those individuals, dorsal scapular artery is a branch of the transverse cervical artery, which is a branch of thyrocervical trunk. But only in some individuals we can see dorsal scapular artery, which is arising from the third part of the subclavian artery. Now let's have a look on each of the branch separately. Vertebral artery is the first branch arising from the subclavian artery. You can see there are two vertebral arteries as right vertebral artery and left vertebral artery. Here also you can see the left vertebral artery only. When we talk about the course of the vertebral artery, it ascends in the neck through the foramina in the transverse processes of the upper six cervical vertebrae. It ascends in the neck through the transverse foramina of the through the foramina in the transverse processes of the upper cervical vertebrae. Here you can see the transverse processes and the foramina in the transverse processes. Only in upper six cervical vertebrae, not in the seventh cervical vertebrae. It passes medially above the posterior arch of the atlas. Here you can see this is the atlas. Then it passes medially above the posterior arch of the atlas, and then ascends to the foramen magnum of the skull and forms basilar artery by joining the two vertebral arteries. This basilar artery involves in formation of circle of Willis. Mainly, it supplies to the parts of the brain. The branches of the vertebral artery in the neck are the spinal arteries and the muscular arteries. In the skull, it gives off meningeal branches, anterior and posterior spinal arteries, then branches to the cerebellum, like that. Then the next artery arising from the first part of the subclavian artery is the thyrocervical trunk. Here you can see it origins distal to the vertebral artery. Here the thyrocervical trunk. Here in this side, this is the thyrocervical trunk. From this thyrocervical trunk, it gives off three branches. They are the inferior thyroid artery. Here you can see the inferior thyroid artery. Then the transverse cervical artery. Then the suprascapular artery. What are the three branches of the thyrocervical trunk? They are inferior thyroid artery, transverse cervical artery, and suprascapular artery. So, when we look at into the inferior thyroid artery, it ascends to the posterior surface of the thyroid gland. You can see the thyroid gland here. It ascends to the posterior surface of the thyroid gland, and it make anastomosis with the branches coming from the external carotid artery, and it supplies to the thyroid gland as well as the inferior parathyroid glands. Then the other branch of the thyrocervical trunk is transverse cervical artery. Here you can see the transverse cervical artery, which is arising from the thyrocervical trunk. It is present only 1/3 of individuals. In those 1/3 of individuals, transverse cervical artery gives two branches as dorsal scapular artery and superficial cervical artery. But in the other 2/3 of individuals, this dorsal scapular artery arising from the third part of the subclavian artery as a separate branch. In those individuals, you can see the superficial cervical artery, which is arising from the thyrocervical trunk. I'm repeating the same thing. The transverse cervical artery we can see only in 1/3 of individuals. In those individuals, dorsal scapular artery and superficial cervical artery are the two branches arising from the transverse cervical artery. But in 2/3 of individuals, we can see dorsal scapular artery arising from the third part of the subclavian artery as a separate branch. In those 2/3 of individuals, the superficial cervical artery directly arising from the thyrocervical trunk. Here in this picture, you can see it demonstrates that 1/3 of individuals, which the transverse cervical artery gives off the dorsal scapular artery. Then here the other third branch of the thyrocervical trunk. In thyrocervical trunk, I told you there are three branches. Inferior thyroid artery, I discussed transverse cervical artery. Then the third one is the suprascapular artery. You can see the suprascapular artery here. It goes above the superior transverse scapular ligament. Here you can see the superior transverse scapular ligament. Then suprascapular artery goes above this ligament and enter into the supraspinous fossa as well as the infraspinous fossa. It also involves in the scapular anastomosis behind the scapula. From the three branches arising from the first part of the subclavian artery, that means they are vertebral artery, thyrocervical trunk. The third one is the internal thoracic artery. You can see the internal thoracic artery here. Internal thoracic artery goes or descends inside the ribs cage, or it is from either side of the sternum. It supplies to the anterior chest wall. Costocervical trunk. Costocervical trunk means the branch arising from the second part of the subclavian artery. So, you can see I have clearly explained. Costo means ribs. So, cervical means neck region. You know that. So, this costocervical trunks gives blood supply to the ribs as well as to the neck region. So, there are two branches which is arising from the costocervical trunk. You can see one branch is the deep cervical artery and the other branch is the supreme intercostal artery. Deep cervical artery gives blood supply to the deep structures of the neck region, and the supreme intercostal artery gives blood supply to the ribs as well as the intercostal spaces. Actually, the supreme intercostal artery gives blood supply to the first and second intercostal spaces. Here, that's all about the subclavian artery. Here, I want to emphasize that about the transverse cervical artery. Don't mix up that. Some book says that dorsal scapular artery arising from the third part of the subclavian artery. Some book says that dorsal scapular artery arising is a branch of the transverse cervical artery. I think now the doubt is clear. What happens in 1/3 of individuals and what happens in 2/3 of individuals. So remember that it can be vary according to the book you refer. So I think this video will help you to learn about the subclavian artery and the branches arising from it. So if you like my video, please subscribe my channel as well as put a like and a comment in the comment section. Thank you for watching.